So the behavioral mechanisms, motivation mechanisms for learning, feeling of pleasure and punishment, all these functions are performed by the basal regions of the brain. So together called as limbic system. Next is Kluver-Bucy syndrome. Kluver-Bucy syndrome can occur if there is a lesion of the amygdala. So in this patient will be having very aggressive reaction and fear response. The lateral area on strong stimulation causes rage or punishment, whereas weaker stimuli will cause a sensation or feeling of reward. Next we have the fornix. Fornix actually continues from the alveus. It is the only efferent fiber that is coming from the pyramidal cells of the hippocampus.
Hello, thank you for tuning in. If you want to come back to this video later, just tap on the like button. It will save it to your liked videos so it's easier to find. And don't forget to hit on the bell icon to get notified whenever we drop new content. Stay curious, keep learning, and see you on the inside.
Good evening, dear doctors. I am an anatomist, so I will be talking more on anatomy and also the clinical relevance of the limbic system. Next slide, please. Yeah, can I move the slide?
Yes, ma'am. Yes.
Yeah. The term limbic means border. It is for understanding the emotional part of our emotional activity of our brain. So the behavioral mechanisms, motivation mechanisms for learning, feeling of pleasure and punishment, all these functions are performed by the basal regions of the brain. So together called as limbic system. Initially, the sense of smell in early vertebrates occupies a portion of forebrain that is called as the rhinencephalon. The term was used by Owen in 1837. Rhinencephalon activates the other neural systems that are responsible for emotional behavior like aggression, self-defense, sexual urge, hunger, salivation, etc. After that, with the development of neocortex, the olfactory system became a rudimentary structure, and emotional behavior of an individual is dependent on other modalities such as psychical cortex, vision, hearing, taste. So emotional behavior is controlled by all these influences rather than the olfactory system. Initially, they thought only the olfactory system is the one which is controlling all the emotions, that is the rhinencephalon. Later, the neocortex replaced the rhinencephalon. How this term was coined, Broca's in 1878 coined the term limbic system, limbic meaning border, and papers in 1937 stressed on limbic system as a center for emotional integration. He is the one who formed the paper circuit with connections of various parts of the limbic system, how it functions as a center for emotional integration. So what are the components of this limbic system? It can be divided into cortical and subcortical components. The cortical components being the limbic lobe and hippocampal formation. In this picture also, we can see the cortical limbic lobe and hippocampal formation. And subcortical systems include the olfactory system, amygdaloid body, septal nuclei, and anterior nuclei of thalamus. So the limbic lobe consists of cingulate gyrus, uncus parahippocampal gyrus, which are part of rhinencephalon, and also the isthmus. The hippocampal formation consists of hippocampus, dentate gyrus, indusium griseum, gyrus fasciolaris, medial and lateral longitudinal striae. So we can see in this the parts of the limbic lobe. We can see the corpus callosum. I am not able to use the cursor. I hope this picture is visible. We can see the corpus callosum from medial surface of the cerebral hemisphere. Above that, we have the cingulate gyrus. And we have the subcallosal gyrus. We can see the uncus and parahippocampal gyrus also. We can see isthmus. So these form the limbic lobe, and we can see the hippocampal formation with the hippocampus, dentate gyrus. We can see the indusium griseum, everything. We can see the amygdaloid body also. So coming to the various parts of this limbic system, amygdaloid body is situated in the deep to the uncus, and it is close to the temporal pole of the cerebrum and is situated in the inferior horn of the lateral ventricle. So here we can see the amygdaloid body depicted in green color. And this amygdala is having various subdivisions, namely the medial nucleus, lateral nucleus, basal, perilaminar nucleus, periamygdaloid complex, accessory basal nucleus. These are the various subdivisions of the amygdala. So it is related to the lentiform nucleus above. Below the amygdala, we can see in this picture itself, we can see the gyrus semilunaris, the gyrus ambiens, and uncinate gyrus. So between this amygdala and the lentiform nucleus, we can see another nucleus called basal nucleus of Menet. So this consists predominantly of cholinergic neurons. Then we have the septal region. So it is a gray matter which is situated anterior to the lamina terminalis. It consists of paraterminal gyri, prehippocampal rudiment, and parolfactory gyrus. So in this picture, we can see in the anterior end, we can see the septal area with all the parolfactory sulci, gyri, prehippocampal rudiment. We can see the paraterminal gyrus also. So this forms the septal region. So what are the connections of the septal region? It receives afferents from the olfactory tract, amygdala, and hippocampus. It sends efferents to the habenular nuclei. Next is the hippocampal formation, which consists of hippocampus, dentate gyrus, indusium griseum, gyrus faciolaris, medial and lateral longitudinal striae. So indusium griseum we can see in this picture, which is situated above the lateral ventricle, and it is a thin sheet of gray matter. So in front it is continuous with the paraterminal gyrus, which is again a part of the septal area. And when you trace this indusium griseum behind, we can see that it is continuous with the gyrus faciolaris and dentate gyrus. So what is dentate gyrus? It is a thin strip of gray matter, crenated strip, which is situated above the parahippocampal gyrus. This is separated from the parahippocampal gyrus by a sulcus called as the hippocampal sulcus. Next part is the hippocampus proper. This is elongated and prominent elevation. We can see that related to the floor of the inferior horn of the lateral ventricle. And this is situated, hippocampus is situated above the dentate gyrus. So it resembles the letter S. So the ram's horn or Ammon's horn. So this is resemblance to the Greek god, Ammon's Greek god. So it resembles the horn. So it was named as ram's horn or Ammon's horn. The superior convex surface is the hippocampus proper, and the lower deep part is the dentate gyrus. The middle limb of the S is formed by another area that is called as the subiculum. All these form part of the archipallium. In this picture, we can see the hippocampus, we can see the dentate gyrus. This resembles like the letter S. So above we can see the dentate gyrus, hippocampus, and the middle limb we can see the subiculum also. All these form part of the archipallium. We are talking still about the hippocampus. The anterior part of the hippocampus has a bulbous extremity that resembles foot. So it is called a spes hippocampi. The fibers of hippocampus which cover the ventricular surface is called as the alveus, and the fibers which pass medially, they form a bundle that is called as a fimbria. Next part is the fornix. Fornix is a sole efferent projection fiber from the hippocampus. It starts as alveus from the hippocampus, from the pyramidal cells of the hippocampus. So the fibers of this, in this we can see the various parts of the fornix. Fibers of alveus converge to form the fimbria, we can see, fimbria hippocampi. The fimbria join and form the body of the fornix. And the hippocampi of two sides are connected by a commissure that is called as the hippocampal commissure. So this is the fornix as seen in dissection. We can see the fornix mammillary body, the hippocampus, pes hippocampus. Next is the stria terminalis. Stria terminalis is a narrow band of white substance. This is situated between the caudate nucleus and thalamus. Caudate nucleus, as we all know, is a part of basal ganglia. It is situated between the caudate nucleus and thalamus. So anteriorly it will be continuous with the fornix, and posteriorly it ends at the nucleus amygdala. Next part is the anterior commissure. Anterior commissure is located in the anterior wall of the third ventricle, as we all know. This anterior commissure connects the olfactory pathway. So the parts of olfactory pathway being olfactory bulb, anterior olfactory nucleus, pre-piriform cortex, entorhinal area, anterior perforated substance, on both sides of the connected by the anterior. It not only connects this, but also connects other parts of the two cerebral hemispheres, namely the orbital frontal cortex, temporal pole, parahippocampal gyri, other regions of the temporal lobes. These are the various parts of the olfactory pathway, namely the olfactory nerves. We can see in the same diagram, olfactory nerves. We can see the olfactory bulb, olfactory tract, olfactory stria, prepiriform cortex, and primary olfactory cortex. So it is ending in the primary olfactory cortex. So we can see the same, the Papus circuit. This is an important circuit, like a circular pathway. It interconnects the structures in the limbic system. So it interconnects the fornix mammillary body. From mammillary body, we have a tract called as mammillothalamic tract that goes to the anterior nucleus of the thalamus. As we all know, we have various nucleus in the thalamus, anterior nucleus, ventroposterolateral nucleus, etc. So from the thalamus, it goes to the cingulate gyrus. Again, it is connected to the hippocampus. So it interconnects the structures in the limbic system. So what are the functions? Why we have to study all this in detail? What are the functions of the limbic system? So it preserves individual and species by defense and flight responses. It is responsible for self-defense, aggression if there is some disorder, search for food and water, mating. Emotional behavior of an individual, both subjective feeling as well as the physical expression of the emotional behavior, is controlled by this limbic system. Storage of recent memory. Recent memory is stored through the Papus circuit. If there are some lesions in the hippocampus, it can produce course of cause psychosis, in which the patient may be confused and as well as have amnesia. So it also happens in B1 deficiency and chronic alcoholism, course of cause psychosis, as we all know. Next is Kluver-Bucy syndrome. Kluver-Bucy syndrome can occur if there is a lesion of the amygdala. So in this patient will be having very aggressive reaction and fear response. Through the connections with the hypothalamus, the limbic system activates the autonomic nervous system when there is some emotional response. In Alzheimer's disease also, the limbic system is involved, in which there is memory loss. The reward as well as punishment centers are also located in the limbic system. Rewards as well as punishment centers. And where are they located? The limbic structures are concerned with affective nature of the sensory sensation, whether it is pleasant or unpleasant, whether we receive award or punishment, whether we are satisfied or we are having aversion towards something. All these are controlled by the reward and punishment centers. The reward centers are located in the medial forebrain bundle, in the lateral and ventromedial nuclei of thalamus. The lateral area on strong stimulation causes rage or punishment, whereas weaker stimuli will cause a sensation or feeling of reward. On punishment centers, the most potent areas for punishment are the central gray area, which surrounds the aqueduct of Sylvius. In the midbrain, it extends upwards into the periventricular zones of the thalamus and hypothalamus. Less potent areas of punishment centers are amygdala and hippocampus. Now we are going to discuss about a clinical case. In this, a 28-year-old man is brought to the emergency department with 1 day history of severe and uncontrollable rage and aggression. His friends report he has been acting strangely for the past days, and he is becoming easily agitated and lashing out at them without any reason. He is becoming agitated. On physical examination, he appears agitated and restless. He has tachycardia and elevated blood pressure also. He has difficulty following commands and he seems disoriented. So when the past medical history of the patient shows he had a severe head injury from a motor vehicle accident 2 years ago that resulted in loss of consciousness, and that time CT was taken and it revealed bilateral damage to the temporal lobe with a small lesion of the left temporal lobe. On neurological examination showed cranial nerves were intact, motor and sensory examination was normal, and cerebellar examination also showed normal coordination and balance. The neuropsychological examination was done and which showed there was mild cognitive impairment. His memory was relatively intact, language was normal. Additionally, he had undergone EEG, which showed abnormal electrical activity in the left temporal lobe, and MRI shows a small lesion in the left temporal lobe, especially in the uncus. So that appears to be pressing on the amygdala and the hippocampus. So what is the likely cause of this patient's aggressive behavior? Probably the lesion is in the left temporal lobe, specifically in the uncus region. So this is causing pressure on the amygdala and hippocampus. As we all know, the amygdala is a key structure involved in processing of the emotions, particularly fear and aggression. So damage to the amygdala can lead to abnormal emotional responses. So the patient is having increased aggression and rage. That is because of the compression of the amygdala. The hippocampus is also involved in emotional processing. So hippocampus is closely connected to the amygdala. So if there is dysfunction in this circuit, it can lead to abnormal emotional processing. So specific limbic structures, limbic system structures involved in this patient could be the amygdala, which causes patient's aggressive behavior. Hippocampus, damage to the hippocampus may also be contributing to his abnormal emotional responses. The treatment and management part of it, surgical intervention to relieve the pressure on the amygdala, medications to manage the aggressive behavior like SSRIs or mood stabilizer, and behavioral therapy to help manage his emotions and behavior. To summarize, limbic system is a system which controls the emotions, behavior of an individual. So the components of the limbic system consists of the limbic lobe, In the limbic lobe, we have cingulate gyrus, uncus, parahippocampal gyrus, and isthmus. In this, the uncus and parahippocampal gyrus may be called as the part of the rhinencephalon. Hippocampal formation consists of hippocampus, dentate gyrus, indusium griseum, and gyrus faciolaris, medial and lateral, longitudinal striae. So initially it was thought that the olfactory system was the one which is controlling all our behavior and emotional responses. With the development of neocortex, it became evident that limbic system was the one which is controlling our emotions. Initially, Broca coined the term limbic system. Then papers in 1937 stressed on limbic system, and he developed a circuit for showing various connections in the components of the limbic system. So in limbic lobe, we have the cingulate gyrus, which is located above the cingulate sulcus on the medial surface of the cerebral hemisphere, and uncus and parahippocampal gyrus forming part of the rhinencephalon. Then we have the amygdala. So amygdala is an important structure which is situated deep to the uncus, close to the temporal pole, and it has got various subdivisions, namely the medial lateral nucleus, periamygdaloid complex, basal nucleus, etc. There is also septal region. In that we have two sulci, posterior, anterior parolfactory sulci and parolfactory gyri. We have paraterminal gyri, prehippocampal rudiment. So these are the components of the septal region. Coming to the hippocampal formation, we have indusium griseum, which is a thin sheet of gray matter. In front, it is continuous with the paraterminal gyrus, and behind it is continuous with the gyrus faciolaris and dentate gyrus. So dentate gyrus is a crenated strip of gray matter which is situated above the parahippocampal gyrus, and it is separated from it by a hippocampal sulcus. In hippocampus, we have it resembles the letter S. So the upper convex surface is called as the ram's horn. Lower D part is called dentate gyrus, and the middle limb of transition is called as subiculum. And anteriorly, it is having a bulbous extremity resembling the foot, so it is called as pes hippocampi. Fibers on ventricular surface forms the alveus. Fibers which pass medially, they form a bundle called as the fimbria. Next, we have the fornix. Fornix actually continues from the alveus. It is the only efferent fiber that is coming from the pyramidal cells of the hippocampus. Then we have striae terminalis, which is a narrow band of white substance which is situated between the caudate nucleus and thalamus. Then we have anterior commissure, which connects various parts of the olfactory pathway, and Peyer's circuit, which is a connection between the, I just want to highlight the connections of the Peyer's circuit once again. Fornix, hippocampus, mammillary body forming mammillothalamic tract going to the thalamus. From there, we have thalamo-cingulate tract going to the cingulate gyrus. So the various functions of limbic system are emotional behavior, storage of recent memory, and the lesions of the limbic system can cause diseases such as Korsakoff psychosis, in which there is confusion and amnesia, Kluver-Bucy syndrome, which is resulting from lesion of the amygdala, causing aggressive reaction and fear response. Alzheimer's disease also can happen because of the loss of memory. We have various reward and punishment centers in the limbic system. Thank you. If you have any questions, you can post it in the comment box. Thank you.
Thank you so much, ma'am.
Yeah.
We have a few questions here.
Yeah.
But before I get to it, I have a few questions myself that I will ask.
Yeah.
Okay. So, what are some practical signs or symptoms that you would suggest to look out for limbic system dysfunction after mainly like an head injury, like in the
Yeah.
previous case that we discussed,
Yeah.
especially in an emergency setting?
Yeah. The patient may be having an uncontrollable rage or aggression, and there may be disorientation, and he may not respond to the commands. So these are the signs we have to guess it is from the limbic system. Probably the lesion is in the limbic system.
Okay, ma'am. There is one question here by Dr.
Yeah.
Rajendra.
Yeah.
Improper fight responses harms the functions in which situation?
Improper?
Fight responses
Yeah.
harms the function in which situations?
I don't understand. Harms the function. Can I just read this question from the comments?
Yes, I have highlighted it. You can read it at the bottom. But in the
Yeah.
meantime, Dr. Rajendra sir, if you can explain the
Yeah.
question a bit more in the comments, it would be better.
Fight responses harms the flight responses. Yeah, I can read the question. Improper flight responses harms the functions in which situations? If that is lack of, I think, lack of self-defense, right? If there is some disorder of the
Yes.
limbic system, there is lack of self-defense. So there is no proper flight response. So the animal or the human is likely to may not express the defensive mechanism, self-defense mechanism. Is that?
Yes, ma'am.
Yeah. Okay.
Uh, one more question that I could.
Yeah.
One more. Yes. Uh, there was the slide that was being shown right now. Could you
Yeah.
briefly explain how the understanding of the Pape's system circuit is
Yeah.
relevant in evaluating the memory issues in our
Yeah.
clinical practice and how we can ensure?
Yeah. The paper circuit is the one, the main function of the paper circuit is understanding the connections between various parts of the limbic system, like mammillary body, the thalamus. From thalamus, the fibers go to the cingulate gyrus, then to the fornix. So we have to understand all these connections, the afferents and efferent fibers. So the important function of this paper circuit is emotions and memory. So if there is some lesion in any part of it, so it can affect the memory of the patient. So understanding of paper circuit is very important.
Yes, ma'am.
Okay.
Ma'am, there are a few questions in the chat.
Yeah.
If you could check once.
Yeah.
Dr.
I can
Rajendra,
see only the comments like
this
insightful. Yeah.
how
How
limbic
limbic system abnormality causes depression and schizophrenia. The feeling of pleasure or any unpleasant sensation is also controlled by the limbic system. Pleasure or if the patient is sad. So in that, I think the lesion of any limbic system abnormality can cause depression, but schizophrenia, I'm not very sure.
okay.
Maybe through the psychic cortex or something.
Yes. If anybody wants to ask any further questions, they can drop in the comment section right now, and we will take them up. In the meantime, ma'am, do you have any message or any points that we can do or we can follow in our clinical practice for to noting down any limbic, like so that we are aware of limbic system
Yeah,
injuries?
yeah. Even maybe when we are seeing psychiatric patients, most of this may be considered as some psychiatric disorders, right? So we should also keep in mind there may be a lesion of the limbic system in such cases. When the patient is very aggressive, or if there is some lack of emotional behavior, emotional disturbances, or is not responding to commands. So we should also keep in mind that there might be a lesion of the limbic system.
Yes. We don't really have any more questions in the comment section right now,
Okay.
but we have appreciative comments
Yeah.
for this, and thank you for
Thank
enlightening
you.
on the limbic system.
Okay.
So in the meantime, if there are more questions, you can ask it in the chat box right now,
Okay.
or after in the replay section, you can share it there, and I can relay them to the ma'am, and ma'am can answer them
Okay.
for you later. Yes.
Thank you.
Yes, that brings us to the end of
Yeah.
today's session.
Yeah. Thank
Yes.
you very much.
Ma'am,
Thank you for all the audience, and thank you for your all positive comments. And thank you, Dr. Sainika, for having this session.
Thank you so much, ma'am, for
Thank
joining
you.
us today.
Thank you.
Yes.